So members, I'm back again. So Frankie Pepe from Northern Uganda is asking, Swanky, the next topic, next time you put doctor. So Dr. Swanky, the next topic you should talk about cord prolapse. Yes, so cord prolapse is a medical emergency during childbirth where the umbilical cord prolapses or drops through the cervix into the birth canal. Yes, it can be either alongside or before the baby. So when the cord prolapses, it is going to be compressed between the baby and the wall of the birth canal of the mother. This can bring about cutoff of blood or oxygen supply to the baby, which can lead to a condition known as hypoxia. It is just as simple as oxygen deprivation, yes? When the baby is starting to lack oxygen, that's what we call hypoxia, which is very fatal. So basically, we're having three main types of cord prolapse. The first one is the occult prolapse, where you'll find that the umbilical cord is being compressed by the baby, but yes, it remains alongside with the baby, and it's always difficult to detect. Why? Because it doesn't protrude into the birth canal or the vagina. Then we're also having overt prolapse, but for this one, it protrudes into the birth canal or the vagina, and it can easily be palpated, yes, using the hand. And the last one we're having is the phonic presentation, where for this one the umbilical cord is between the presenting fetal part and the cervix, and this one in most cases it is diagonized by ultrasound, that is before labor. So cord prolapse is more likely to occur under the following condition. The first one is premature rupture of the amniotic sac, which is going to be accompanied by release of the amniotic fluid, which in layman's language most of you call it what? Water breaking. Yes, in layman's language, I think that is what most guys understand most. And then the second one is multiple pregnancies, which is characterized by individuals maybe having twins. And then the third one, if an individual is having a long umbilical cord. And then the fourth one, when such individuals have excessive amniotic fluid. And also the last one, when there is poor engagement of the fetal head during labor, a condition as doctors we call breech presentation. Yes, so what are the signs and symptoms of cord prolapse? Yes. The first one we can talk about is visible or palpable umbilical cord in the vagina or in the birth canal. So you'll find that the umbilical cord can easily be palpated by the hand in the what? In the birth canal. And then the second one is changes in the heart rate of the baby. A term we call it brachycardia. Yes. And then the last one, yes, the mother that is in the labor can feel unusual sensation in the birth canal. So let us go straight to the management and care that should be given to the mother in the labor room, because these circumstances can bring about hypoxia, yes, fetal hypoxia, which can bring about death of the baby. So it needs immediate taken care of in the birth. So the first thing that we shall look at, so we shall have to reposition the mother, yes, in either in the knee chest position in order to relieve pressure from the what? From the umbilical cord. Then we should also do what we call elevation of the presenting part of the baby in order to prevent compression of the umbilical cord. And the best option is always immediate delivery, which is often by emergency cesarean section. And the best option is always immediate delivery, which is accompanied by emergency cesarean section. And last, you should also know that there is always close monitoring and intervention of the mother and the baby so as to bring about good outcome. Yes. And then someone in my comment section was asking whether men are allowed in the labor room. Yes, basically, if you're not a doctor, you're not allowed in the labor room, because what are you going to do there? What are you going to see, first of all? Yes. For us doctors, we know we are seeing only biology there, and what we are doing basically, we are going with the heart of helping. Thank you so much for listening. If this information is so useful to you, hit on the like button, and you can tell me something else that I can put in my next video. Yes, thank you so much for listening.